Welcome back, family, to the Doctor Next Door. I'm your host, Dr. George Korede. Today, I have a really special guest, Dr. Ciara Robinson, to talk about skin health, skin cancer prevention, and our biggest skincare myths. Welcome to the show, Dr. Robinson.
Thank you. I'm excited to be here.
Yes. As always, this podcast is for educational purposes only. It is not personalized medical advice. If you have concerns about your personal health, please speak to your healthcare provider. All right. So, Dr. Robinson, I am really pumped about this episode because I have two daughters, I have a wife, and I've learned a lot about skincare that I did not know before I got married and had kids.
Yeah, understood.
If you know where I'm going. So it's really cool to have one of our own talk to us about skin health, our hair, misconceptions, and all that stuff. And I'm just really excited to hear all the cool stuff and tips that you have for us. Okay. So I always start by asking Dr. Robinson, what drew you to skincare as your field of study? Like, was there a patient, yourself, perhaps? Was there a moment in your life where you're like, you know what? I really want to dedicate my life to helping people with their skin.
Absolutely. So I struggled with skin issues when I was younger, a teenager, like a lot of our population does. There was actually a Black dermatologist in my hometown that was instrumental. He let me come and shadow. I got kind of a peek into the field, and I was like, wow, this is really rewarding to be able to see someone with a skin issue. They can see it, the world can see it, right? Because most things we see in dermatology are visual, and being able to provide them with treatment options and actually see the change when they come back to see
Right.
you. So that was super rewarding. There's also a paucity of Black dermatologists. I mean, 3% of dermatologists are Black. So being able to kind of bridge that gap to be able to better serve our people who also need dermatologic care, that was something that I was passionate about.
Sure. So, okay, so let's jump into it for all our listeners here. We're going to start with skin myths. Okay. What
Okay.
is your biggest pet peeve as a dermatologist, as a myth that everybody believes? They're putting it all online, but clearly there's no science to back this myth. What is the biggest skin myth out there?
I mean, so I'm in Florida, so I see skin cancer all day, every day. And I have patients every day when I ask them, are you good with your sunscreen and your photo protection? Are like, wait, doesn't sunscreen cause skin cancer? And I'm like, no, it's not absorbed into the body. It's preventing skin cancer because chronic sun damage from the UV rays causes DNA damage and causes skin cancer over time and people that are susceptible and more prone to it. If they're worried about that, there's always just mineral based sunscreen. So, zinc oxide, titanium dioxide. If you're worried about chemicals, you can just use ones that have no chemicals, 100% mineral, if that's going to ease your fears. But in the grand scheme of things, wearing sunscreen is what you should be doing every day to protect your skin from the sun.
Regardless, yes. So, but Dr. Robinson, I'm Black. I don't have to wear sunscreen, right? Like, listen, I can just get by, right? My skin has the stuff in it that keeps me from getting skin cancer, right?
I hear that one all the time too. And so while people of color, so we do have melanin in our skin, right? And that provides a small bit of protection from the sun, but it's not enough. So wearing sunscreen every day is important for us, not only for prevention of sunscreen, but also anti-aging things. If you are getting, sun rays is going to degrade your collagen, it's going to cause decreased elastin over time. So it's going to kind of accelerate your aging of the skin. And then also, so a lot of people of color suffer from pigmentary disorders, whether that be dark spots from acne or rashes on the skin, melasma we see commonly. So visible light is going to be is going to exacerbate hyperpigmentation. So that is why wearing sunscreen every day, tinted sunscreen for patients of color, I recommend all the time, is going to help because it has visible light protection. So if you're just sun rays all day, every day, even coming in your house windows and your car windows, that is still sun exposure. So that is going to cause those types of dermatoses and hyperpigmentation to last longer than if you were to protect yourself from the sun.
So even though I am African American, I still need sunscreen to protect myself from aging, all sorts of hyperpigmented issues, hypopigmented issues that occur. And of course, you can still get skin cancer, right? So I think that's a
Absolutely.
huge myth that I wanted to debunk first because we got you here on the show, and a lot of my patients included do not believe that. So you're
Yes, and I will add one small thing is that so while we're less likely to get skin cancer than our counterparts, when we do get skin cancer in patients of color, it oftentimes we present later, so it's diagnosed later and the prognosis is worse. So it's very important to follow these steps.
Absolutely. What are the you mentioned some different options of sunscreen. What are some of the more affordable ones that you like that you say, hey, you know what, this is the one I recommend for most of my patients? I know you touched on a few, but yeah.
Absolutely. So CeraVe has great tinted sunscreen options. Some brands have universal tints where it's tinted, but there's not different shades. But CeraVe's got some universally tinted ones as well as Neutrogena. Neutrogena has a UV mineral tint, 100% mineral. It comes in 4 different shades. I recommend that daily to patients. Going a little bit higher in terms of cost is La Roche-Posay. They have one that also comes in 4 shades. It's very light and fluidy. It almost looks like you're wearing a thin layer of makeup. That's the one that I personally wear every day. And for patients where it's feasible cost wise for them, I do recommend that on a daily basis as well.
Very good. So, and then kids as well, young kids, you know,
Absolutely.
yeah,
6 months and older, mineral sunscreens for kiddos. Blue Lizard has a really good one, mineral. Give that out every day to the kiddos as well.
very, very good. Okay, so we're going to change topics a little bit and talk about skincare products. There are so many skin influencers online, Dr. Robinson. I mean, I don't know if you've noticed, but it's kind of a big industry.
Absolutely.
So I have to ask, what are the biggest waste of money? What are the myths? What are the ones that don't do anything? What are the ones that can hurt you? I mean, I watched a video earlier this week in preparation for this where a guy did a skin peel, I think, and he messed up
I've
his
seen that.
whole face. And I
Yeah.
was like, he was a handsome young brother, and I was like, yo, I don't who you talking to, bro? Like this
Yeah.
is not good. So only God knows. I pray for him. Hopefully he gets a recovery. But I really wanted you to talk about the tried and true skin products and then the things that are myths and the things that may actually hurt you.
Absolutely. So, tried and true, a good skincare routine does not need 12 steps. You need a good cleanser, a moisturizer, you need a sunscreen. If you want something for acne, anti aging, a retinoid, prescription strength if you can tolerate it. And then, if you want to add in things like a vitamin C serum, that's good for free radical protection. It's an antioxidant, and also things that are good or acids, glycolic acid, salicylic acid, mandelic acid, lactic acid. Those are some options, and those can help with hyperpigmentation. They can unclog pores, exfoliate, and help with overall skin texture over time. Some things that I feel are not really worth it to spend money on. So I hear people now we're talking about PDRN or these little DNA fragments. People are saying, oh, it comes from salmon sperm, and that it can come from that. It's a bunch of different sources. But there's just not a lot of data to support the use of that on the skin topically. In addition to that, people are, let's see, what are people using? Now, oh, hair, skin, and nail vitamins.
That's gonna
They're
yeah.
like, I mean, they've got really high concentrations of biotin. Biotin, we know, can interfere with lab testing, especially like troponin. So if
I
you're
see.
having heart issues and you go to the hospital, but you're taking really high amounts of biotin, that can become an issue.
Okay.
And then there's just, if you're not deficient in those vitamins, there's not a bunch of data saying that those are going to be helpful for you.
Are there any other kind of natural supplements and things like that that could be beneficial? A lot of times the science isn't quite there yet, but are you anecdotally, do you know of any mom and pop grandma used to use this type stuff that may help?
Yeah, so there are some things that can be helpful. There's like Nutrafol is a pill supplement that has some things on it that kind of help calm down inflammation and give you the proper building blocks you need to build healthy hair. That one can be kind of pricey, but I do have patients that are able to afford it. So they purchase that. You take like 4 pills a day, and I've seen some good results with that. Honestly, I've seen some patients that use that solo without anything else. I think it's more of a good adjunct therapy. So that's a pill. And then there's also a new that was developed with dermatologists. I will say a lot of the dermatologists that helps develop this gummy are dermatologists of color, and the gummy is called Extress A,
Okay.
and it has anti-inflammatory, antioxidant properties. Another good thing that is included in that one is saw palmetto, which has shown some data to support healthy hair and help treat hair loss.
Absolutely. So, speaking on hair loss, what are some of the most common causes? Hair is a big deal, okay? Maybe you guys
Absolutely.
don't know that out there, listeners, but hair is a really big deal to our female listeners and our male listeners, quite frankly. I don't want to
Yeah.
just make
Yeah.
make it about females. What are some of the most common causes of hair loss?
Absolutely. Hair is a big one. I mean, it's such a big part of our identity. And in the Black community, a lot of people struggle with hair loss for a very long time before they go get help. So some of the most common reasons I see that are causing hair loss. So hairstyles. So there is a type of alopecia. And let me just back up. So alopecia is just the overarching term for hair loss. I'll have patients come in, they complain about hair loss, and they're like, oh my gosh, like I don't have alopecia, do I? If you have hair loss, you have alopecia. It's just an umbrella term. There's multiple different types.
That's correct.
So styling practices can cause traction alopecia, where you get kind of thinning and increased tension on the hair follicles. It's very common to see kind of the frontotemporal scalp, tight wigs, sew-ins, quick weaves, braids, buns, all the slick backs, all of those things contribute to that over time. It's important to notice it early because in its early stages, it's not scarring. Once you progress years and years, it can become scarring in nature. And once you have a scarring type of hair loss, it's very difficult to get hair regrowth in those areas that are scarred.
Mm.
Other common types of hair loss, so telogen effluvium is a big one. So that's associated with
Stress.
added stress on the body. So surgery, anesthesia, pregnancy, significant weight loss, illness, all of those types of things can cause shedding,
Mhm.
and that typically occurs about 3 to 4 months after the inciting event. It's typically self-resolving and will kind of go away on its own in 6 to 12 months.
Yeah.
Another very common type of alopecia that we see on a daily basis is androgenetic alopecia. That can affect all of these can affect both males and females, but
Sure.
that's, females come in, they say, "Oh, I feel like my part is widening or my hair is kind of thinning overall." Males kind of have this recession of the hairline or that kind of bald spot in the top of the head. And that's just when your hair follicles are susceptible or kind of hypersensitive to DHT or a
Mhm.
hormone that we have in the body and the hair cells, and it causes the hair follicles to shrink over time. So
Yeah.
it gives the appearance of decreased hair density. The good thing about hair loss is if you go to a dermatologist early and get a formal diagnosis, there are lots of different treatment options we have for hair loss that work very well.
You hear that, fellas? Going to Turkey and doing a hair transplant. You got a ticket to Turkey. You could just go to your dermatologist. Listen to that, okay? No, just trying to make y'all laugh. But and then with females as well, there are things you can do to
Lots of
actually help
things.
and reverse.
Yes,
Sometimes, I know not always, but sometimes that can
correct.
be beneficial. You just got to get to the right dermatologist. It sounds like.
Yes.
Very good. So I do want to lean in a little bit because if I left this episode without asking about which hairstyles do you prefer and which ones are good for hair growth and cultivate healthy hair, my wife, my two sisters, and my two daughters would be very upset with Dr. Korede. Okay. So, so I gotta hear what are the things that you say, hey, this is good. This will keep your hair nice and neat, but keep it healthy as well.
Absolutely. So wearing your hair in its natural state, if possible. So loose braids, twists, cornrows, wearing your hair in a low bun and just kind of lightly pulling it back without a lot of tension on the hair. Um, a lot of times I'll tell my patients it's important to know that I think we're kind of susceptible to think that, okay, every single hair must be in place, right? Like it has to all be pulled out back, it has to be very neat, but that it doesn't have to be all slicked back all
Right.
the time,
Yeah.
right? Like
Yeah.
it's okay. It is okay. If you're going to get braids, make sure you don't keep them in for more than a few weeks at a time, which can be hard, right? We spend a lot of money, we spend a lot of
Listen,
time going to get
listen.
our hair done. We want those styles to last.
Hmm.
But if you struggle with hair loss, it is important to give your hair a break, wear your hair natural when you can. And when you have these styles, just be mindful of who's doing it, right? Are they really invested in the overall health of your hair? When you go and get braids, is it hurting so much that when you get home you have to take some ibuprofen? Like, or do you have extreme redness of the scalp? Do you have bumps on the scalp? Those are all signs that the style that you're wearing is too tight. So these styles can cause hair loss over time. And it's not to say that you can never wear them, kind of cycle hairstyles.
Sure.
Get braids or sew in, like wear it for, 4 weeks, 6 weeks at a time, and then wear your hair natural. And, special occasions, it's okay to do these things, but
Hmm.
important to be mindful. If you're in pain, the hairstyle is too tight, it needs to come out.
Very good. I mean, I think that right there is a bar. I mean, natural hair, let it breathe, shouldn't be painful. Cycling, right? Give your hair a break, right? I think all those things are good. And then you kind of alluded to the fact that some of the sisters out there, I know y'all got to get it, a certain way to be professional in
Yeah.
quotes.
Trust
Hear
me,
my
I
heart,
understand.
ladies,
Yes,
in quotes, right?
yes.
But at the same
Yep,
time, putting that pressure on your hair repeatedly may not always be the best thing, right? Very good.
correct.
So we're going to talk a little bit about aging. That's another $1 billion industry, Dr. Robinson, in case you haven't heard. And there's a lot of stuff out there. I'm seeing red light commercials. I'm seeing masks. I'm seeing different types of ointments and stuff you can put on your face overnight. What are your thoughts in general? Are there stuff that we should all be doing? We've already talked about UV light and how that causes the skin to age. But are there other things we can do to make sure our skin is healthier and not cause excessive aging or accelerate aging in our skin?
Absolutely. So things that you hear like on a daily basis, making sure you're drinking enough water, that improves, excuse me, the elasticity of your skin, a healthy diet, exercise, adequate sleep is important. Avoiding smoking, all of those are big things like overall, not just for your skin, but for your just overall health and well-being as well. In regards to the skin, there are so many different things out there, but you have to listen to your skin and know your skin. Everybody's skin needs a moisturizer, right? If your skin is more dry, using a thicker moisturizer can be helpful. Things like hyaluronic acid serum can help kind of hold in some of the moisture on the skin. For anti-aging purposes, the best bang for your buck, aside from wearing sunscreen every day, is going to be a topical retinoid. So there's lots of different over-the-counter options. Adapalene previously was only prescription strength, but it is available over the counter now. That's different. La Roche-Posay has one. You can find it at your regular drugstore. If your skin can tolerate it, a topical retinoid is going to decrease the appearance of fine lines, wrinkles, dark spots. It's going to build collagen over time. So I would definitely recommend that. Go to your dermatologist and get a prescription for that. Red light masks and things like that. So there actually is decent data to support those. However, it depends on the brand. And forgive me because I don't have any specific brands that I can recommend
Sure.
for the red light, but you just have to make sure that it was appropriately tested. Like some are saying, oh, the red light, it's low level light therapy, but it's really just LED. So you just kind of have to like really read up and do your research. But the data actually does show it's helpful for a lot of different things. I mean, skin health, acne, decreasing inflammation, as well as hair loss.
Did you just say somebody's going to try to sell me a mask that's got TV lights in it? Is that what you just said?
Yeah, yeah.
Okay.
So be careful.
Okay.
There's some scamming people out here.
Okay.
Just be careful, be
Okay.
mindful.
Okay. Well, very good. I mean, I know that's a big industry, and I think there's so much stuff being thrown at you on social media or in the commercials and stuff. It's always nice to hear the truth and things that may not help at all, right? So that's very good. So we'll transition a little bit. I always love asking specialists, what is your personal nighttime face routine or your personal moisturizing routine? Because people want to hear from you. If you do this, maybe I should be doing that too. And it kind of humanizes you and makes us all feel like we're in this thing together.
Yeah, absolutely. So my nighttime routine is super simple, excuse me. So use a CeraVe oil cleanser. It's over the counter. It's not expensive. I've been using that brand for many, many years. I wash my face with that, pat dry, do a hyaluronic acid serum. Right now I'm using a Vichy one, and then I follow that with my tretinoin, which is a topical retinoid. Over top of that, if my skin is super dry, I'll put another layer of moisturizer on top of that and kind of sandwich the two.
Okay.
But if my skin's not so dry and I can tolerate it, just do my tretinoin, and that's it. So sometimes my skin really likes lactic acid. Sunday Riley makes a good one. It's called Good Genes. So if I'm not using my tretinoin, sometimes I kind of alternate. Like, okay, I'll do a lactic acid or a glycolic acid. The Ordinary has a good one. There's a lot of good brands out there, but I mean, it's very simple.
Yeah, very good. And is that just a nighttime routine? Is that morning and night? Is there a different one kind of in the shower? Could you kind of speak on that a little bit? Yeah.
Yeah, so in the morning, it depends. Sometimes I just use the same gentle cleanser. Kind of have acne. I kind of in and out of consistency to be completely honest, but
Sure, sure.
benzoyl peroxide is a good cleanser for acne and it's anti-inflammatory. So I will use that a couple of days a week as well. I do use a hyaluronic acid serum in the morning, and then I also use a vitamin C serum. There's a lot of different ones out there. I am currently using SkinCeuticals CE Ferulic. That's very good. And then topical retinoids. can be inactivated by the sunlight. So I just use that at nighttime. In the morning time, it's just those things and sunscreen and head to clinic.
Very good. Very good. So, before we let you go, we really appreciate Dr. Robinson blessing the podcast with some of her time today. We wanted to ask if everyone started one skin habit today, what would you recommend that it be? Just one thing to
Do you have a
improve their.
guess?
I
It's
do. I
sunscreen.
I
Every
do.
day,
Yeah,
yes, you gotta do it, you
yeah,
gotta do it. My people of color, y'all too.
yeah,
Patients are shocked. They're like, "What? Me?
yeah.
I need sunscreen?" Yes. Find a good tinted sunscreen, find one that you like, and you will wear every day, and I'm telling you, your skin will thank you over time.
Like I'm telling on myself here. I don't put on sunscreen on a daily basis, like going to and
Okay.
from work. But with the
Mhm.
UV index being as such, I should be doing every single day, even that brief walk from the car to the office and things like that.
Absolutely, I would, especially on your face. Don't forget the ears, they are exposed too. The lips are a place that we see skin cancers too. So if you can find a good lip with SPF 2. But yes, I hear that all the time. He's just like, well, I don't get a lot of sun. I'm like, well, how did you get here? Right? Because the sun was coming through your car
This sun
windows. If
right
you had
here.
to walk, yeah. I mean,
Right,
yeah,
right,
that's exactly
right.
right.
Yeah,
Got to do better.
very good. Well, Dr. Robinson, we really appreciate you coming on and blessing the podcast. We'd love to have you back. If people want to follow you, follow your post online, or come visit you in person, is there any place that they should visit?
Yeah, absolutely. So I am on Instagram, ciararobinson.md. Got some content going, some educational, some humor. And in terms of clinics, so I'm located just south of Sarasota in Osprey, Florida. So if you're in the Sarasota area or you're in Florida, I'm happy to see you. I am accepting new patients.
Excellent. Awesome. Amazing stuff. Great interview. You found this conversation helpful. Please like, subscribe, or share this episode with someone who could benefit. Let us know in the comments what other topics you'd like to cover next. Thank you guys for spending time with the doctor next door. Have a great evening.